When Bill Zagorski took over his family's elder care business, they were mostly doing home care and getting around $200 per caregiver per day. Well, now they're mostly doing adult day health services and they're getting over $500 per caregiver per day. This episode is really a master class in how to move back and forth between home care and adult day services and how they go together so well. Enjoy.
Welcome to the Home Care Heroes and Day Service Stars podcast. If you provide services to keep older or disabled people living at home, then this podcast is for you. Now, here's your host, Ken Accardi.
All right, well, welcome to another episode of Home Care Heroes and Day Service Stars, the podcast. You know, it's a lot of our episodes historically have been home care focused. We've been doing more day services content, and today is actually an episode about day services, but it's for home care folks. And as a matter of fact, myself and our guest today, who I'll introduce you to in a second, are going to be at an excellent national conference, which is the National Adult Day Services Association, NADSA conference. That's going to be in September in Georgia, right in Atlanta, Georgia. And so what we wanted to do today was we want to talk about the adult day services market a little bit. And, you know, since we have mostly a home care audience, we want to talk about a trend that we're seeing, which is more and more home care agencies are adding adult day services to their mix. So without further ado, I guess I've already blabbed a lot. I'd love to introduce our guest, Bill Zagorski, or let you introduce yourself and tell everybody about what you do.
Yeah, thanks, Ken. So happy to be here today. Happy to talk a little bit more. So my name is Bill Zagorski. I own and operate a home and community-based organization in Middle Tennessee. So American Senior Care Center Incorporated is my company. We are primarily adult day healthcare in Middle Tennessee. I have 3 brick and mortar adult day healthcare locations. We also are a very small home care provider, non-medical home care, transportation provider, then dabble also in case management, chronic care management, and gosh, my words are escaping me at the moment. Have started actually into the PTOT and therapeutic space a little bit more through partnership. So truly an HCBS provider. So this, right up my alley, talking about the combination of service and revenue lines. I also have the joy of serving. I have a problem saying yes, so I serve on a lot of different boards. But I've been the president of the Tennessee Association for Adult Day Services for the better part of 7 years. I chair the Tennessee Federation for the Aging. I also have the joy of serving as both the research committee chair and the board chair of the National Adult Day Services Association. So I've been on the research committee for about 7 years and the board chair now going on for 4 years. So like I said, I have a problem. Because the problem is saying no. So I guess I say yes.
Yeah, because you don't seem to have a problem saying yes at all. It seems like you maybe have a problem saying no.
Right.
But I mean, what a fantastic background. I mean, between, serving not only the adult day services in your 3 centers, but also, having at least a little foot in the door and doing some of the services in the other areas and being in the national, connected to the NADSA, committees and those board roles and that type of thing, as well as in your state, but, much broader. I think you're the perfect person to talk about this. So the first thing we'd love to, just get a little bit more of your background is, how did you get into adult day services? I mean, that's your main business. What got you there?
Sure. Totally. Well, by accident and by provenance, I guess. So my parents started our company in 1991. So my father had been with HCA for a number of years, had a business plan for HCA to have hundreds of adult day locations in the 80s. They were busy buying hospitals and making a ton of money, so that didn't work out then. My grandmother had been in an assisted living in Chicago, and we moved her here with us about the same time that my father had exited HCA, and they had decided to start that business plan to have hundreds of adult day locations, which again, that didn't work out either. But when we opened, it was about the same time my grandmother had attended a social model program. She became incontinent, wanderer, dementia progressed, so there's nowhere for her to go. So we started as the first medical model adult day program in Tennessee in 1991. I was young at the time, not to date myself, but I was not even in high school yet. I had no desire to stay home or anything. So my career actually took me to Ohio. I was in med school, got bored. So I went back into research. So my tenure was actually as a non-tenure track research assistant to research associate at the University of Cincinnati College of Medicine, mostly in cancer cell biology, and then pivoting over to neurobiology, virology, immunology, and still love the research field, hate writing grants. So left research in 2010, 2011, decided to come back home. And at that point, we had, we'd been open for 20 years. We had one center running, 20 members a day, but the majority of our footprint was in the home care space at that point. Tennessee had gone, it was one of the first to go through the managed care conversion and the Medicaid waivers. So we were a large home care provider. Since then, we've retracted the home care space slightly, but we've really grown in the adult day space. So we do have, I opened a second center in 15 and a third in 18. The home care space in Middle Tennessee was incredibly saturated back in 2015. So we just kind of declined that a little bit. We don't do a lot in the Medicaid waiver space in Tennessee, mostly in the state options program space, which is a little bit more challenging for smaller providers just because of the lower amount of hours. But so yeah, I mean, it was kind of by accident, but totally fell in love with it. It's, to me, the entire home and community-based space is the answer to the age-old question of how do you age gracefully without being in a nursing home. Don't get me wrong, there's good nursing homes, but there's also a lot of bad ones. And who can afford all the good ones anyway? So try to make it a little bit more affordable for everybody to live the rest of their lives.
Yeah, perfect. Well, it's kind of interesting because you did start, or I guess you said that when you really stepped in and stepped out of research, that it was primarily home care, and now then you really grew up the adult day services side. So I guess what was attractive to you about that model? I guess you told me that the home care was a little bit more saturated in Tennessee at the time, but on the adult day services side, like kind of what said to you, hey, this is something that we could grow and that maybe the world needs more of?
Yeah, so at that point in time, the home care side was saturated in Davidson County, but the pay rates in the Medicaid waiver space were not very, very high. I mean, they have increased over time, especially over the past few years. But since it was so saturated, it was highly competitive for members. And to be perfectly honest, I was, a little bit more mission driven than profit driven. There was a lot of, for-profit entities that were really pushing, in the home care space. And there is still, plenty of profit to be made.
Sure.
We operate a for-profit company too. But the adult day side, being able to serve individuals longitudinally with chronic diseases and that chronic care management was actually really appealing to me. And it's still to this day hard to quantify and hard to show the value proposition. But being able to serve individuals with a much higher acuity in a group-based setting does kind of alleviate some of those challenges that you have in the home care space, where the one-on-one level of care can be a barrier. So being able to have individuals with advanced dementia, advanced physical disease, but being able to interact with them and keep them engaged while still maintaining their health. And since we're a medical model, we have the nursing services and some connection to therapeutic services too. So we're able to serve a more highly acute population in a longitudinal capacity to really allow them to live at home longer and longer, and still allow the caregivers to afford that same lifestyle for a lot longer too. So again, it's not that I think one is better than the other. I think adult day was just a little bit easier, and we had the capacity in my Nashville location at that point in time to grow it. And then the opportunity to add on second and third locations was, I've never backed down from a challenge, and so it was very challenging. Don't get me wrong, but very rewarding as well too. So the reward aspect of it is significant. You do get to be very, very close with a lot of families and a lot of members over time. So you do go to more funerals, but the reward aspect of it is very fulfilling.
Right. Okay. Well, I guess just, since we are speaking broadly about adult day services, how do you see, that business in that market? And I mean, we all have seen the same statistics that, the number of people in their 80s in this country is still going to more than double in the next 20 years and things like that. So how do you see the state of the market today, demand for adult day services, and where do you think it's going to go?
Yeah, for sure. And so adult day continues to grow. And again, it was growing significantly prior to the pandemic. The pandemic happened. There was a significant attrition, most because adult day services, much like home care, did not get federal support during the pandemic. And then, of course, being regulated at the state level made it even more difficult. But since then, we've seen a return actually to pre-pandemic levels from brick and mortar locations, if not higher. So the industry continues to grow and evolve over time too. The most significant areas of growth over, let's say, the past 10 years, both pre and post pandemic, We've seen a real shift in the pay source. We've seen a shift in the size of programs. We've seen a shift in the clients that are served, and we've seen a shift in the operational capacity. So previous, 15 years ago, the adult day industry was really dominated in the not-for-profit space. But the for-profit space has really increased over the past 10 years. And it's not because the margins are significantly higher, but it's because it is, it's almost an easy add-on services for some programs. It's also the for-profit industry is a little bit more nimble than the not-for-profit industry too. So being able to be very specific to a situation, a certain demographic is easier. Also, we've really seen a growth in age and diagnosis agnostic services. So individuals with intellectual and developmental disabilities made up a significant portion of the population of day hab services prior to the pandemic, but individuals with ID are aging and experience the same issues as other aging individuals. Also, if you're running an adult day program, whether it be social or medical, it's not necessarily just for an individual with dementia. It's for an individual that needs assistance. And individuals with intellectual developmental disability can be served either in the exact same location or in a very similar manner, co-located, slightly separated either way. So the programs that are age and diagnosis agnostic, being able to serve individuals from 18 to 118 of every physical, cognitive, intellectual, and developmental, difficulty have really grown much more significantly and much faster than dementia-specific programs or 65 and older specific programs. And those programs are still growing. It's just a different demographic that being able to serve. The other aspect that is very poignant in the growth is the class services, so culturally and linguistic appropriate services. So you see a lot of programs that serve a very specific ethnic or cultural minority. There's dozens of hundreds of Spanish speaking programs, Chinese American programs, Korean American programs, Haitian Creole programs, Kurdish programs, Somali programs. So programs that are able to serve a niche community and a niche market, generally served by one of their own, own members. So it's kind of easy to start a program and then being able to serve that population. And kind of the other main reason for growth too is adult day was by and large a Medicaid-based service for years, and where it had been 80+% in the Medicaid area, it's now down to about 40-50% in the Medicaid space. And it's not that Medicaid is paying less. It's that other providers and other payers are paying more. The VA is the second largest provider of adult or payer for adult day services. There's Medicare Advantage that pays some, Older Americans Act. There's lots of small grants too. So you see more payers. The private market continues to expand, and it's still the lowest cost long-term care option. So there's a lot of tailwinds behind it. So the market as a whole is actually larger than it was pre-pandemic. And I think it continue to grow significantly.
Yeah, well, that's so many sources of growth that you shared. So thank you for that. And a lot of different payers and models. And it sounds like, like you said, the Medicare Advantage is coming up. Most of our audience here is what I would classify as non-medical home care, as opposed to, kind of your home health that do the Oasis and the 30-day post-acute. That's not so much the audience of Home Care Heroes. We're more of the folks that are taking care of both older and IDD folks, so they could stay in their homes for a long time. So I think that there's more synergies there. I guess let's talk a little bit about, obviously your expertise with the medical background and everything, and being able to create a medical model and the impetus with it being your mom and all. You've kind of grown on the medical side, but I would say for our typical listener, if they're running a non-medical home care agency, maybe they have their 1 or 2 nurses on staff that are doing evaluations and those kinds of things, and then they wanted to go into adult day. For me, that would seem like a little bit lighter lift than to kind of go to a bigger medical model. So I guess I see you nodding in agreement for those who are listening to the podcast as they're driving somewhere. I guess having said that, let's kind of look at it and say, and obviously it's a big country and the rates are very different in Boston than they are in Dubuque or whatever, that kind of thing. But let's say that, our average home care agencies are getting like maybe 35 an hour or something for private pay services, and the Medicaid programs are paying, hopefully most of them are paying north of 20, but 24, 25 an hour. for that. And that's like a one-to-one, one caregiver
Right. Right.
working with one client in their home and that sort of thing. So talk to me a little bit about like the rates and the ratios in an adult day center.
Yeah, absolutely. And can just real quick touching on kind of that social medical division. It's really not a huge division. There are a number of states that have differential licensure for social model of care and medical, but the majority of states really have either a single level of licensure, or if you're licensed as a medical model, you're also a social model as well too. And the NPAL survey, the National Post-Acute Long-Term Care Survey from the CDC, does analyze, where this industry is. As of the last report in 2020, 80% of the market was a combination of primarily social with some medical, or primarily medical with some social. So there isn't this huge siloing on the edges anymore. It's really this huge bell-shaped curve where most providers are somewhere in the middle. Talk about average rates and average ratios. This Genworth, of course, runs the cost of care survey, where it shows that the average cost of care, the Medicaid rates are fluctuating. By and large, the staffing ratios are between 1 to 6 and 1 to 8 across the United States. Some states are a little bit more stringent, where it might be 1 to 5, especially in the medical models. And I've seen it, I think, as little as 1 to 9 or 1 to 10, strictly in some more social model states. Really, the industry standard is kind of a 1 to 6, 1 to 7 ratio, and that really serves both the social and the medical aspect of it. So financially, it's not really a significant difference. The pay rates too. There are some states that have a differential pay rate for social model and medical models, but they're not significantly different. When you're talking about going from $12 an hour to $14 an hour, those pay rates are not really different when you have a high enough volume of services. And even the states that have medical model licensure, whether you call it adult day healthcare, medical adult day care, medical model services, most of those medical model services, it doesn't include MD support. It does not include the requirement to provide, PT, OT, and speech. So you're really not providing that skilled level of care. There are a few states where you do have to provide that. I mean, mostly on the left and the right coasts, or even in Mass or California. And the rates, of course, are higher in that medical space. But at an average staffing ratio of 1 to 6, and your pay rates are $13 an hour, sometimes as a per diem, sometimes as a per unit. You're looking at $80 to $120 a day for services. So for five participants, that's $700 in reimbursement per individual staff at an average pay rate of say $17 an hour. It's already profitable, and it covers those services. It's not a high margin industry, by and large, kind of operates in that 10 to 20% margins, it's on net EBITDA. But again, as an add-on service is really where, I've been preaching for years, and a lot of times it's preaching to the adult day environment, saying, add on home care services, add on transportation, add on other HCBS services. And I've worked with a lot of home care providers too, that are talking about, hey, we have a brick and mortar office, and we have this building, the suite next door at 2,800 square feet. Do you think that would be a good addition for a small adult day program? Well, absolutely, yes. It's, you're a nominal increase in operation costs, and you hire 3 additional staff to add in another $15,000 a month of revenue. Absolutely. So
Yeah, for sure. Yeah, and I guess, just kind of going down the crux of the math, I think in home care, people mostly think in hours, and a lot of times in day services, folks think in days, right? Because a
right.
lot of times the program is, the folks are coming in for like a 6-hour day or something like that. But I'd love you to recap, like, you mentioned in there that sometimes the social model is $12, where the medical model is $14. I think those were hourly rates. Is that correct?
Right.
Right. And then, but you did kind of throw out that, for example, given that you have, let's take the worst case scenario, that 1 to 6 ratio, and let's say that that's where you're required to be. So you have one staff, dealing with 6 clients. Let's say that you're getting 6 hours a day times, times $12 an hour. So that would be like 72 times 6. So 7 sixes are about $450 a day. And if that caregiver is, there probably not for 6 hours, but more like 8 hours, because they're there to greet people and see people go, then that is going to be more like, you're paying your caregiver 145 for the day, and you're collecting based on that, like the 450 per day was the math that I did.
Right.
And, maybe in the medical model, it's more like, 5 to 700 per day. So, I guess, in a sense, it sounds pretty attractive, but then the other, kind of question that sometimes when home care folks are looking at this is, they're afraid of the unknown. I mean, like just like
Right.
the day services people would say, oh my gosh, I'd have to do EVV, I'd have to do, all these kinds of things, right?
Right.
That they don't know, that home care people are like, oh, that's so easy. But then when we look at it from the opposite direction, the home care person saying, well, I need real estate and I need, food and things like that.
Right.
So, so what would you tell somebody who was like running a home care agency and considering this about, those aspects and, that the unknown that's unknown for them, probably like, you could do it with your hands tied behind your back on your side.
Right. Yeah. Yeah. I mean, the fear of the unknown is definitely, a challenge. And of course, the hardest hurdle is usually the real estate aspect of it. Lease rates are not inexpensive, but if you have, someone that has a brick and mortar home care location that has a larger capacity, or a suite next door that, you're able to work out a lease agreement for, a 3-year lease for a social model program, build out costs for social model programs, depending on how it's already built out, are pretty low. You really don't need a significant kitchen. A lot of programs have their meals catered, so you might just need a microwave and a kitchenette. Bathroom requirements, are usually in that, 1 to 6, or you need 2 bathrooms, so you have 2 ADA compliant bathrooms and 2 kind of large rooms for activities. You might need an extra office, or if it's next to your home care operation, then you already have an office involved. So the lease rates are the single largest expense besides staffing. Meals, yes, you can have them catered in. We actually we create all our own meals. We cook all our own food. We do that as a single location and then cater basically to our other locations, either frozen or fresh. There is reimbursement in adult day space for meals. So the Child and Adult Care Food Program does allow each individual state to administer it to adult day programs. So that offsets the overwhelming majority of your food costs. So even as a for-profit institution, you're allowed to enter in the CACFP. So some of those questions are easily answered. But yeah, you get to the simple economics of it. You have a manager that has a little bit of capacity to be able to kind of be a program director, co-manager, so you're not really experiencing any additional costs from a management perspective. And if you hire two staff for an 8-hour day, where participants are really only coming 6.5 hours, you have your first 2 staff. And yes, you do have to get to that 7-member a day average capacity, but anything above that until you hit 12 members is all profit. And then if you're at the 12 members a day, you hire a third staff members and you get to 15. So, it is kind of this incremental stepwise
Yeah,
increase.
that's a good point. Yeah, that's something that you don't deal with in home care is, I mean, when you're paying that caregiver, 17 an hour and you're getting paid,
Right.
30 an hour, that's kind of 1-to-1. And if you lose that client, or you gain that client, that's what your margin is. But here, yeah, I guess when you get to that point where you go from let's say 12 clients to 13 clients, 14 clients,
Right.
now you're paying 3 caregivers. So there is that stepwise function, and there is
Right.
that benefit. Yeah, very, very good. Yeah, so I was thinking real estate, and like you said, they have their offices and they're expanding. As a matter of fact, like we got into adult day services because in Kentucky, our home care providers that are providing for the state, they have to have adult day services.
Sure.
And I've been in a number of those centers, and some of them are even like they use space in a church. It's a lovely space,
Right. Right.
and that kind of thing as well. So, and I guess, the pandemic kind of left a lot of commercial real estate, a little bit emptier than it used to be. So there might be
Absolutely.
some bargains there as well. So yeah, and that's kind of interesting. The CACFP is, so even if you're a for-profit day center, you could apply for meal reimbursement.
Yeah,
And
absolutely.
is that like I guess, is it like, you're billing your whatever the program is, or the payer is for the adult day services straight up, but then like is the CACFP, you're kind of it's the same kind of thing, you're doing a separate bill to this separate entity, or are they
So
kind of granting
it
you
is a separate
their own
entity, so
benefit?
it's actually administered by the USDA and then each individual state administers it a little bit differently. you can kind of do it in two different ways. Yes, it is a separate service, and an individual center can apply, and they do have to meet certain criteria. I think it's at least 50% participants have to be below the poverty line. There is a graded reimbursement for breakfast, for lunch, for afternoon snacks. It can be a little bit complex and cumbersome from an administrative side when you're first enrolling in the program. But there's another way through sponsor programs. So there's a lot of, it's the child and adult care food programs. So there's not as many adult programs, but a sponsoring organization. So if I was a new adult day program, I can contact sponsoring organization X in Tennessee, and I say, I want to enroll in CFP, and they'll actually do all the administrative work, tell you what you need to do. And of course, they take a percentage of the reimbursement, but they'll go through all that all the hoops for you. And so instead of receiving, $3,000 a month in reimbursement, you're going to receive $2,000, where the sponsoring organization keeps the other $1,000. And it's a great entry. And when you reach the capacity to be able to operate it independently, you no longer use the sponsor and you just apply directly. But yeah, it's administered differently in every state. It's kind of like adult day, where it's federal into state money, but the overall regulations are the same. And yeah, you do have some industry standards that you have to have certain amount of whole grain foods, a certain amount of protein, a certain low amount of sugar. There's challenges with it, but again, if you're looking for cost assistance, then it helps.
Yeah, for sure. I totally get it. Okay, and then I guess the last aspect of the fear of the unknown, what I was thinking of was transportation. So do a lot of the programs, kind of hire, you get your own van and you're pulling people in, or do you, like I've heard of some agencies that, or some centers who, have like a third party transportation, or yeah, give us a little lay of the land on that.
Yeah, yes to all. So a lot of it depends on what the state requires, or what the state Medicaid agency requires. So some Medicaid agency reimbursement for adult day services is inclusive of transportation. So the provider is responsible for getting the member there. And whether that be they have their own vans and go pick them up, or they contract with a third party administrator or the local paratransit organization, they'd be responsible for arranging and transportation. And instead of being a per hour reimbursement, usually that's where the states are the per diem reimbursement, and it's a 6-hour per diem, where at $125 a day, but it's inclusive of transportation, and they can be in the facility at minimum 3 hours, but up to 7 hours. So that's definitely one model. There are other states that the Medicaid model of reimbursement is just for the hours in the center, the day in the center, and the programs can decide how they want to handle transportation. Some of them states, like Tennessee, for example, Medicaid reimbursement is for the hours in the center. There is additional reimbursement for transportation. And so then that can be handled in the same way. You can contract directly with another agency to provide that transportation. They get paid for it. You can be a transportation agency and transport the members that attend your facility, and we get reimbursement for it. Or families can transport themselves. And so that's really kind of the whole lay of the land. In general, across the United States, about a third of providers or a third of participants are transported by family members. About a third are transported directly by the adult day programs themselves, and a third are transported by outside entities or outside agencies some way, whether it be state or a third party administrator. And again, it depends on the state, depends on the program. And some providers, like, we only do ambulatory transportation. So if somebody needs wheelchair-based transportation, it can be provided by a paratransit agency. So there's kind of that fine graded response. And it depends on the state too, kind of what the van requirements are. There are some states that require full ADA accessible van and transportation, where other states are if you guys are a transportation or an adult day provider and you want to allow your employees to utilize personal vehicles as long as you have insurance, there are states that allow that as well too. So you have an employee that picks up 3 members on their way in, they're covered by your transportation and your insurance. So you've already included that transportation in your staffing costs. So it's kind of another reason where the home care, adult day, really kind of mesh together. So if you have home care employees, and again, there's reimbursement for it too, whether it be Medicare Advantage or outside plans. If they're paying for $6 for transportation to an appointment, well, adult day is that appointment. So there might be a Medicare reimbursement for the transportation service, bring them to the brick and mortar location. You have a home care employee that's getting paid for that. might work in the center as well, and then start work in the afternoon, either taking them back home or providing home care shifts in the afternoon and the evening. So a lot of adult day providers that also have home care services, their staff will have either additional shifts or pick up additional shifts in home care, and vice versa. I've seen home care providers that start adult day agencies, and they have home care staff where a client passes away, where they were working 35 hours a week. Now they only have 20 hours a week. Well, the 2 days a week, they're in the center as the employee, in the center. So you have this cost allocation of FTEs. It can be split without any additional, really, anything additional to the bottom line.
Right. Yeah. And I mean, a few things like, talking about those staffing ratios and things like that that have always come to mind for me are that one thing that happens in home care, if you're, just in home care, is you bring folks in for training, you're paying them for training. There's a lot of, they get in a home with a senior and the home doesn't smell like they're used to, and they have trouble communicating, and now you've trained them for 2 or 3 weeks and they quit in the first week. And I feel like, one thing is if you have those folks coming in for training and they're in the center, they're getting like hands-on experience, and they're really getting more of a flavor for what they're used to, but they're also at the same time they could be helping your ratios and that kind of thing. And then, one thing again is that in a lot of home care agencies, it's like, hey, my mom fell, she's coming out of the hospital tomorrow. A lot of these home care agencies are right. Well, I think I could get a caregiver for you like by the end of next week or something like that. And
Right.
they're out of the running. And, and if you're in your adult day center and you have like some of your supervisors in there and you have the staffing ratios, especially if you have trainees in there, you're like, hey, when are you coming? I could pick you up at the airport. I could take your mom home from the hospital. We could
Right.
get out there today. And I think that there's a lot of, maybe a little bit of those things that, play to your favor and your advantage as well.
Absolutely.
So this has been a time flies when you're having fun kind of situation. Two of us here, we've covered a lot, and kind of, I was going to ask the leading question and say, how could folks learn, especially home care folks, learn more about this industry? And I was hoping that you'd say the answer is they should come meet folks at the NADSA conference. So we'll
Absolutely.
kind of assume you're going to say that, but I've been to NADSA twice, but I'm in the vendor area, so I haven't really been there in the main. I guess, my question is like, who are they going to meet there? Like, and do you think they can meet people who have been through that and people who are, both like yourself have experience with both sides?
Yeah, absolutely. And so, the conference is it's electrifying experience, for crazy people like me that love the industry already. It's like Christmas. But normally it's multiple hundred adult day providers in one location. And there are some educational sessions, obviously that's where the entire thing is educational sessions, but networking opportunities. There's usually some pre-conference sessions. One of the most popular is always a 3-hour in-depth of how to open an adult day center. We usually have a couple of webinars of those every year too, and then kind of an educational curriculum. I know this year we have one of, well, I opened a day center, what do I do now? And it's a 3-hour about marketing and payer assistance and things like that too. But yeah, so it's not just adult day providers, primarily primarily adult day providers and a lot of vendors in and around and adjacent, kind of tangential to the adult day space. But many of those providers, they span the market, they span the states, they span the geography. So it's the not-for-profits and the for-profits. It's the ID and the aging. It's PACE providers and home care providers. It's providers that have provided, medical services, non-medical services, home care, and not. So you really do get span the entire breadth of the industry. And there will, I can guarantee there'll be something for everybody there. It's a great opportunity to network with other providers and find out what works. I mean, and there's a lot of research sessions. Obviously, I'm a big data nerd. So there's a lot of information that kind of where the value-based proposition is. And another thing that, where home care and adult day meets in the future is the value-based proposition, value-based care arrangements and things too. So, we have the ability, especially together with home care, to really affect a change in those value-based arrangements with much less risk. So nobody likes that assumed risk for the total care. But, PACE programs are continuing to expand. A lot of MCOs or managed care organizations are kind of dipping their toes into value-based arrangements, inclusive of adult day and home care, non-medical home care. ACOs are continuing to show interest in, post-acute discharge to adult day with home care implications too. So, I mean, really the possibilities are endless, and it's a great handheld partnership. And I've been a fan for years, obviously, with my experience, but adult day can add on home care can add on adult day. There is no right or wrong. But the fear of the unknown is the challenging, but I can tell you right now, they're both they're both unique, they're both challenging, but they're both, easy to be successful. I really think they're both incredibly viable options that really go together, hand in hand.
Wonderful. All right, well, let's wrap it up and let's kind of give just the details of NADSA. So it's going to be, that conference will be September 18th through 20th. It actually starts with there's a lot of these pre-conferences that happen on that Wednesday, the 18th. And then there's like a reception the evening of Wednesday, the 18th, where a lot of the folks, as you know, sometimes it takes a good part of your day to get into wherever you're traveling to. So this is right in Atlanta, downtown. It's the Buckhead Marriott. So I haven't been, but I'm sure it sounds like a lovely hotel right in the downtown area.
Yeah.
And you would go to learn more about that at the National Adult Day Services Association website, which is NADSA, NADSA.org. And anything else to add to that, Bill?
No, I said the one thing on that first day of September, there are those educational sessions. We also arrange for, I think about a half a dozen site visits. So if individuals are there in town and want to do the site, we have supervised site visits. So we'll take them to one of the adult day programs in the area. I think we have either 3, 4, 5, 6 different programs that we're associating with. So we have those site visits available. But yeah, the reception on Wednesday night and on Thursday night. Thursday night there's a superhero theme, so you might see me dressed up as a couple different superheroes. But those receptions, really, to me, that is probably one of the most valuable parts of the conference, because of the networking opportunities with other providers. Not just some friends, but well, not just colleagues, but true friends and friendships I've developed through the NASDAQ conferences has really been invaluable. So.
Perfect. Well, thank you so much to Bill Zagorski for spending your time today and sharing so much with us. And hopefully we'll see you and some of the listeners who learn more about adult day services through this podcast in Atlanta in September.
Absolutely. Thanks for having me, and happy to provide contact details if anyone wants to follow up.
Thanks for joining us today on the Home Care Heroes and Day Service Stars podcast, produced by Uncoda. You can listen to back episodes by visiting 4homecareheroes.com. That's the number 4, then the words homecareheroes.com.